Now it's up to me to talk about action steps, although you've heard several from David and from Dr. Espelage as well. Next slide. So these are action steps, suggestion action steps for schools, and these are all taken from www.stopbullying.gov, which is the one-stop federal website for all resources related to bullying prevention, so I strongly encourage you to go there. The first action step is to assess school prevention and intervention efforts. You need a good sense of how often bullying occurs in your school, where it occurs. Generally, it occurs in unsupervised areas like stairwells or bathrooms. You need to take a survey to determine how your staff are responding when it occurs and how effective these efforts are. As David mentioned, and as Dr. Espelage indicated in her remarks about characteristics of programs that work, it's very important to engage parents and youth in these efforts. There are school-level health committees where parents and students sit on those, and those folks should be involved and engaged in these efforts. It's important to have school policies and rules related to bullying. There is a great document by the U.S. Department of Education that gives examples of what elements should be in state and local policies, and you can find that on stopbullying.gov. It's important to build a safe environment for all students. Although there are certainly prevention and intervention strategies that need to be targeted, we need to create environments where all students are respected, not just tolerated, but respected, and where difference is seen as something as special and unique and not something bad. And then finally, all students and school staff need to be educated about policies and about effective prevention strategies. Next slide. These are parent tips for electronic aggression. These can be found on the CDC website. Our main tip here is that parents frequently view the internet as a place to go to get information, and kids just view it as a place to go like they're going to the mall. So we encourage parents to take the same stance and attitude when kids go online as they do when kids leave the house. That is to ask them, where are you going? Who are you going with? And what are you going to be doing when you go there? We encourage them to develop mutually acceptable rules for behavior. Technology can be a good thing, especially for kids who don't feel connected to other kids at school. So we don't recommend necessarily prohibiting use of it, but for developing rules. And we encourage parents to go to those sites that their kids are going to talk to the parents of other kids that they're friendly with and find out what behaviors they're engaging in and what things they're saying. Just like we're encouraging the school to connect with parents, we're also encouraging parents and other caregivers to connect with the school. And then finally, educate yourself about what is going on both with your child and more broadly, and what prevention strategies would be most appropriate for your family. Next slide. We encourage educators to examine current policies. As I said, use the data, figure out what's working, what's not working, to explore current programs to prevent both bullying and general youth violence. I think Dr. Espelage did a great job summarizing the research related to both bullying prevention and more broadly youth violence prevention strategies. Offer training for educators and administrators on electronic aggression. Frequently they're not familiar with the technology kids have and how they're using it. Talk to kids to find out what they are doing so you can tailor prevention and intervention strategies appropriately. Work with the information technology support staff in school. Sometimes classroom teachers are aware of the electronic behavior of their students, but this isn't passed on to the IT staff at the school who might be able to take preventive action in terms of educational strategies as well as perhaps blocking software. As I mentioned earlier, create a positive school atmosphere for all students. There's some promising evaluation results for positive behavioral and intervention supports program, or PBIS, that works about creating a positive atmosphere. And then finally, have a plan in place for what should happen if an incident is brought to the attention of school officials, so that there are graduated, clear steps that all school staff are taking and implementing consistently. Community prevention strategies. Again, I'm going to encourage you to go to stopbullying.gov. Under the prevention tab, there's a great toolkit for communities, a PowerPoint presentation and a toolkit for communities. I encourage you to go there. The take-home messages are, again, work collaboratively with both youth and parents. Study both community needs and strengths rather than just giving bad news about what's going on in your community. What assets do you have that you can build upon? And finally, make sure you develop a comprehensive community strategy that has the community and parents and schools all working collaboratively together. Slide. In that strategy, you should describe your comprehensive strategy, what each partner will do, and how they're going to respond to bullying and prevent bullying, how they're going to educate about prevention policies in school, raise awareness about your message, and track progress over time to ensure that you're refining your approach based upon data, not just anecdotal evidence from individual students or parents. Next slide. So in sum, I think all of the presentations that you've heard today support the case that bullying is a public health problem. Regardless of how it's defined, the data here has shown that it's very prevalent among school-age youth. It has significant effects or associations with both physical health and mental health problems across actually both victims and perpetrators. In terms of future needs, as I mentioned at the outset, there's a need to standardize the definition of bullying. The CDC has worked in partnership with the Department of Education to develop a standard definition and data elements, which is going to be used for surveillance and research purposes. That's due out in December. There's a need to continue to build the evidence base of violence prevention programs related to bullying outcomes, and you heard Dr. Espelez talk about some of her research in that area. There's a need to assess policies and their relationship to bullying behaviors, what key elements of policies have been associated with decreases in bullying behaviors, and there is a need to examine the relationship between bullying and engagement in other health risk behaviors such as sexual risk behaviors as well.